Okay, so this is a good question. It has to do with the coding guidelines for COVID. So first we'll read the guideline and then we can go over it. Okay, so I'm just going to read the part in green here. It says, for sequela of COVID-19 or associated symptoms or conditions that develop following a previous COVID-19 infection, assign a code for the specific symptom or conditions related to the previous COVID-19 infection if known, and code U09.9 post-COVID-19 condition unspecified. Okay, so what this means is if a patient no longer has COVID, so they test negative for COVID, but they still have a condition or a symptom going on that's related to the COVID, and your report says that those things are related, you would code that as U09.9 for post-COVID condition. Okay, in the next part of the guideline in orange there, code U09.9 should not be assigned for manifestations of an active COVID-19 infection. Okay, so that means if the patient does have COVID, you would not use that U09.9 code, you would use U07.1. Okay, and the last part of the guideline says if a patient has a condition associated with the previous COVID-19 infection and develops a new active current COVID-19 infection, code U09.9 may be assigned in conjunction with U07.1 COVID-19 to identify that the patient also has a condition associated with the previous COVID-19 infection. Codes for the specific conditions associated with the previous COVID-19 infection and codes for manifestations of the new active COVID-19 infection should also be assigned. Okay, so a lot of information there. Okay, so what they're saying there is if a patient has COVID and then it goes away, but if they have a condition related to that COVID infection, you would code U09.9 plus whatever condition they had. And then if they somehow get COVID again and test positive for COVID again, you would code U07.1 with the U09.9 and the conditions related to that COVID infection. Now, it doesn't really say what order to put the codes in. If I was coding this, I would put the U07.1 first because that's the code for an active COVID infection. Okay, I hope that helps.